Hi, my name is Collin Baker, and I'm doing a presentation on the costs of Alzheimer's. Alzheimer's disease is a serious illness that is prominent in the elderly community and eventually leads to death. Currently, there is no cure, and there are limited treatments that can be very expensive. According to an article from AARP, the average cost of care for an Alzheimer's patient is $56,800 per year, with 60% of it, which is about $34,500, being covered by the family members and caregivers. With independent care, a family can expect to spend around $850 a year on the Alzheimer's patient. However, once the patient needs to be transferred to a healthcare facility, the price drastically increases to around $20,535 per year. The reason for such a steep price is because there are multiple parts to the care of Alzheimer's. According to Alzheimers.org, these costs include ongoing medical treatment for Alzheimer's-related symptoms, as well as the diagnosis and follow-up visits, medical equipment, home safety modifications or safety services for a patient who wanders, prescription drugs, personal care supplies, adult care services, in-home care services, and full-time residential care services. Because most Alzheimer's patients are older, Medicare is an option to help reduce costs. To start off, Medicare is the health insurance company for our country and applies to those who are 65 years or older. However, you can only receive the free Medicare benefits if you or your spouse is able to receive Social Security benefits or railroad retired benefits, you are the dependent parent of a deceased child, or if you or your spouse has worked a government job long enough to receive free benefits. There are 4 parts to Medicare. Part A constitutes hospital insurance. This means it helps pay for inpatient care, skilled nursing facility care, hospice care, and home health care. Part B constitutes medical insurance. This helps cover some services, from doctors, outpatient care, and durable medical equipment. To get the benefits from Part B, the recipients must pay a premium fee. However, some people have to pay a higher premium fee to enjoy the medical insurance benefits. This is based on the income that is submitted to the IRS. For normal Medicare beneficiaries, the government pays around 75% of the premium fee, while the recipients only have to pay 25%. Those with higher incomes have to pay upwards to 35, 50, 65, or even 80% of the fee. Part C of Medicare is the Medicare Advantage program, which just provides an array of plans for recipients to receive all of their services through one provider. And finally, Part D of Medicare is the prescription drug coverage. This part helps to cover some of the medication that doctors prescribe. Medicare will pay for most outpatient prescription drugs, including Alzheimer's treatment. However, they will not pay for supplements, such as vitamins. The best parts of Medicare that apply to Alzheimer's patients include hospice care, renting of medical equipment, emergency department services, and non-lab tests. To qualify for hospice care, you must have a doctor certify that you have under 6 months to live. The good part is that patients with Medicare do not have to pay for hospice care at all. However, the bad part is that most Alzheimer's patients can suffer through several years before they finally reach the point to where they can receive their free hospice care. With medical equipment like wheelchairs and hospital beds, Medicare covers 80% of the rental costs, and you only have to pay the final 20%. You also pay only 20% for non-lab tests, which include X-rays, MRIs, and other diagnostic tests. However, Medicare does not cover most long-term care, which is the biggest and most expensive part of Alzheimer's care. For example, Medicare does not cover home health care unless the patient is confined to being at home and cannot leave, as well as needing some sort of therapy or skilled service. Medicare does not cover nursing homes or adult daycares because the only service being performed is personal care, which normally includes assistance with bathing, feeding, toileting, and dressing. Because Medicare does not cover long-term care services, prices can add up quickly. According to Alzheimer's.org, the average costs for long-term care in the U.S. are $78,110 per year for a semi-private room in a nursing home, and $87,235 for a private one. $41,724 per year for basic services in an assisted living facility, $21 an hour for home health aid, and $70 per day for adult daycare services. According to SeniorHomes.com, the average cost to stay in a community that offers memory care is $4,064 per month. This was based on the average cost between 16 states throughout the United States. With Alzheimer's comes the risk of having other diseases and problems, which include diabetes, pulmonary disease, and heart failure. According to research from Howard Fillett, MD, Gerald Hill, PhD, and Robert Futterman, PhD, the annual costs of comorbid conditions are as follows. Cerebrovascular disease is $15,346 per year. Congestive heart failure is average $17,846 per year. Chronic pulmonary disease, an average of $12,855 per year. Diabetes, uncomplicated, average of $10,731 per year. Peripheral vascular disease, with an average of $16,999 per year. Malignancy, with an average of $14,266 per year. Myocardial infarction, with an average of $17,105 per year. Renal disease, with an average of $19,168 per year. Diabetes with chronic complications, an average of $20,628 per year. And finally, peptic ulcer disease, with an average of $12,080 per year. Not only is the cost of Alzheimer's a serious issue to the families with patients, but also to the nation as a whole. According to Alzheimer's.com, in 2013, the direct costs of caring for those with Alzheimer's to American society will total an estimated $203 billion, including $142 billion in costs to Medicare and Medicaid. Total payments for healthcare, long-term care, and hospice for people with Alzheimer's and other dementias are projected to increase from $203 billion in 2013 to $1.2 trillion by 2050. So as you can see, Alzheimer's disease is also costing the nation billions of dollars. With the costs to treat Alzheimer's rising, it is crucial that as a nation, we continue to search for both a cure and better treatments for this devastating disease. If anyone has any questions about my presentation, feel free to ask them in class, and I will address them to the best of my capabilities. Thank you.